We'll talk a little bit about the impact on the family. Next slide, Vanessa. So why do we need to focus on families? For a long time in this field, we have been putting a lot of effort into the child, a lot of interventions, and focus has been on the child, considering that this is a disability that affects individuals. But really, disability affects the whole family. And particularly developmental disability is often unexpected, and it's usually an atypical situation. That is that the majority of families are not coping with disability, but a minority of families are. So it's an unusual situation that certain families find themselves in. And so there's no real parenting model for parenting a child with a disability. So often, we look to our grandparents, we look to our elders, we look to even our friends or other community members to kind of pass down knowledge about how to parent or how to care for a child. But in a case where you have a child who is different or has a disability, it's really difficult to look to others for that kind of knowledge. And maybe others are also very hesitant to share knowledge because they might not know quite how to do it or how to help other families in the community. So this puts families of children with disability in a kind of unusual place in the community. We know that families function as a system, and the impact is felt. It's sort of like a ripple effect. It's felt in the whole system. It's not just one family member that is affected, but it is the whole family as a system, and the family system will function differently when there is a child with a developmental disability. We know this. We know there's lots of research that shows that a child with a disability like autism is more dependent on the family, and that they're dependent for longer periods of time. So although families go through different life cycle changes, entering formal schooling and then transitioning to high school, eventually going off to post-secondary or leaving the home. All of these stages do happen in families with children with developmental disabilities, but they do take longer. And in some cases, in many families, the child doesn't necessarily leave the home, and the caretaking happens for well into adulthood. What's particularly important for the study that we are talking about today is how these families rely on government supports, professional services. They are not just an add-on, they are essential to these families. So, most of us, if a government policy changes, we may read about it, we may shake our heads and say, oh my gosh, the government, cutting this or that again. But for these families, it affects them, their daily functioning. It is essential to how they function as a family. And if a service is cut or if a service is missing, it can be absolutely devastating. Next slide, Vanessa. So in this next part, we're talking about how family quality of life differs before and during the COVID-19 lockdown. So we had some data from a study we did years ago with my former student, Dr. Emily Gardner. And so we took advantage of that previous data and compared it to what we found now in this COVID study. So I'm going to turn it back to you, Vanessa, to discuss those findings.
Yep. So again, this sample here, the sample information for the during COVID-19 sample, this is the same. This is the same information as before. The only difference in this slide is the addition of this before COVID-19 sample that Grace mentioned. This data comes from Dr. Emily Gardner. So we use this sample to compare how families were doing before COVID-19 and now and during the pandemic. So I'd just like to note, so this data was collected around, I think, 2014. So there's a bit of a time gap, but the service model in BC has pretty much been the same since then. So similar to the current COVID-19 sample, we have the majority of respondents in Emily's data. 84% were mothers. The age range is roughly similar, where the average age for her sample is about 45. There is a difference in the age range of the child that the caregiver reported on. So you could see that Emily's sample their age is higher. It includes caregivers of autistic adults. So the age range goes up all the way to 36, whereas our data only collects responses of caregivers of children between the ages of 1 and 20. So as with the current sample, the comparison before COVID-19 sample is mostly male children, and the majority of families surveyed are in the same income group. So this 80 to 110,000 annual income. And approximately 19% of the study sample in this before COVID-19 group is non-white, which is roughly similar to ours. So this section focuses on family quality of life. So we're just going to spend some time talking about how this outcome is measured and conceptualized in research. So the particular scale that was used for this study is called the Beach Family Quality of Life Scale. So this scale assesses various domains and areas that are believed to contribute to a family's quality of life. So this family interaction domain at the top here assesses perceptions of relationships between family members. So for this subscale, for example, parents are asked to rate how satisfied they are that their family supports each other to accomplish their goals. This parenting domain here measures satisfaction with activities that the family engages in to facilitate their child's development. So for this subscale, parents are asked to rate how satisfied they are that family members help the children learn to be independent, things like that. The emotional well-being domain assesses perceptions of stress and support availability. So for this subscale, the parents are asked to rate how satisfied they are that they have friends or other people in their lives to provide support. So in other words, it's looking at informal supports in the family's life. And this domain is different than the disability-related support domain, which looks at more formal supports and services and their satisfaction with the supports in their community, as well as other contexts. So the child's school, their work, if they're an adult, and their home environment. So for this subscale, parents are asked to rate how satisfied they are that the family, for example, has a good relationship with service providers who work with the child with a disability. And this last one here is the physical or material well-being domain. So this subscale measures satisfaction with their physical needs. So do they have dental care, medical care, and transportation to get to their appointments? Do they have money to pay for their expenses and things like that? So a critical component of this Beach Center Family Quality of Life Scale is this perception element, this idea where one family may perceive a similar situation in a positive light, another family in a similar situation may perceive a greater negative impact. So it really captures this subjective perception aspect. So this beach family quality of life scale includes 25 statements, 25 items that fall into each of these 5 different domains that we just talked about. So parents rate each of these 25 statements, and their responses range from very dissatisfied, which is given a 1, to very satisfied, which is given the highest score of 5. So lower scores in a certain domain or overall, because it measures overall quality of life. Lower scores indicate lower family quality of life, whereas higher scores indicate a higher quality of life or greater satisfaction. And this scale takes approximately 20 minutes to complete, and it has been shown to be a valid and reliable tool in research. And these are just some example items from this scale. So parents rate their satisfaction with various statements such as, how satisfied am I that my family enjoys spending time together? So this particular statement would fall into the family interaction domain, for example. So they're separated into different domains so that professionals, researchers, clinicians, they can evaluate which areas families are doing well in, and also where they may be not doing so well, where they need more support. So that they can target specific supports and interventions based on the family's needs. So now I'll just talk about some of our results. So for this graph here, you can see 3 different colored bars. So this first dark gray bar here represents families of typically developing children. So we've added this data here so that you could see a comparison. So this data actually comes from a study by Zuna, Selig, and Summers. And they look specifically at typically developing children and their families using this exact scale. So looking at families of typically developing children, you can see on average they score 4.35. So you can see their mean scores in these boxes here. Again, the highest score you can get on this scale is a 5. So the 5 is the highest. So 4.35 is quite high. And when we look at families of autistic children before, so this diagonal bar here and then this white bar here, these are both autistic families. We can see already that there's a significant difference and specifically a decline when we compare autistic children and their families compared to families of typically developing children. And when you compare these 2 bar graphs, so using Emily's data and our current data, it doesn't look like a huge difference, but this was statistically significant. So we see a significant decline in families' overall family quality of life. So when we take the average of all of the different 5 domains of the scale, on average, families are scoring lower during COVID-19. So in the next few slides, we'll look at each of these 5 domains that make up this overall total score so we can see which specific domain families are doing better or worse in. But the main message here in this slide is that families of autistic children score much lower in family quality of life compared to families of typically developing children. And then once the pandemic hit, their family quality of life further declined significantly. And this was illustrated by a quote from a parent who said, "It's a decline in quality of life for all of our family members. Supports and relief for families simply wasn't there, and my mental and physical well-being has taken a toll." So again, these different aspects mapping on to the different domains of family quality of life. So now looking at the family interaction domain. So this domain, again, it assesses perceptions of relationships between family members. So an example of one of the items in this subscale asks parents to rate how satisfied they are that their family enjoys spending time together. They're able to solve problems together and things like that. So again, we see families of typically developing children score quite high, so 4.4 out of 5, 5 being the highest score. For this particular domain, we did not find a significant difference between the before sample and during sample in autistic children and their families. There is a decline when you compare these 2. So families before the pandemic were scoring 3.7 3.76. And then during the pandemic, the average score dropped to 3.64. So this is a drop of 0.12 points. It's not very significant. It was very minor. And when reading the open-ended responses, we did see a lot of variability when families were commenting on their relationships within their family. So some parents commented that the pandemic allowed them to spend more time together, spend more family quality time together, whereas other families reported more negative perceptions. So for example, one parent was quoted as saying, "Right now, my child stays and visits with any relative that will agree to have her, just to provide a healthier environment for her siblings and myself, as our relationships are eroding without additional supports and marginal access to respite." So we can see there wasn't a difference between these two samples, and this was also reflected in the open-ended comments. We saw a lot of variability. Now looking at the physical well-being domain, so this domain measures satisfaction with the family's physical needs. Do they have access to dental and medical care and things like that? Do they have enough funds to take care of their expenses? So we see that compared to families of typically developing children, families of autistic children rate their satisfaction in this area much lower. So when you compare the typically developing sample with the families of autistic children, there's a significant decline. There are many out-of-pocket costs that parents of children with disabilities, specifically autism, report having, and this is due to the range of different supports that are required across the lifespan. And there are many supports and services that fall outside eligibility criteria for funding. And depending on the child support needs, there's usually not enough funding is what families typically report. So when we compare before and during COVID-19, we see a significant decline in their satisfaction, specifically in this physical well-being domain. So one parent commented that the increased living costs during the pandemic have caused some hardship. For example, purchasing extra cleaning supplies, soap, masks, gloves, hand sanitizer. So on top of these funds that they're required to pay out of pocket, they also had to worry about these extra cleaning supplies and safety equipment during the pandemic. Now looking at the parenting domain, so this measures satisfaction with activities that the family engages in to facilitate their child's development. So for this subscale, parents are asked to rate how satisfied they are that family members help the child with disability learn to be independent. Do family members help the child with their schoolwork? Do they support their hobbies and interests? So parents of typically developing children on average rate this domain significantly higher than both of these two groups here. Comparing before and during the pandemic, we found a significant decline in this domain for families during COVID-19. And looking at open-ended responses, many parents emphasize the challenges of balancing new and additional roles, being a caregiver, an educator, trying to keep their families healthy and safe during this time. So it's not too surprising that caregivers report lower satisfaction in this particular domain. So to highlight these challenges, one parent commented, "We have had anxiety and stress for years, but COVID made everything worse. As the caregiver, I wasn't doing a good job and felt like it was all my fault. Not being able to give my child a proper structure has caused major tantrums and destructive behaviors at home, not being able to go anywhere." Now looking at the disability-related support domain, so there's no typically developing sample here to compare with for this domain because it looks specifically at satisfaction with disability-related supports, which is not relevant to families of typically developing children, so we don't have, that's why there's only 2 bars here. So again, the disability-related support measures satisfaction with supports in their community, as well as other contexts of school, work, and home. So for this subscale, parents are asked to rate, for example, how satisfied they are that their family has a good relationship with service providers that work with their child with a disability. So when we compare families of autistic children before and during the pandemic, we see that there's a significant decline in this particular domain. And in my thesis, which looks at barriers and facilitators to accessing autism services in BC, I saw that even before the pandemic started, parents report significant barriers to accessing services, including long wait lists for diagnostic services that are publicly funded, things like that. So when I was going through the comments that parents were writing, it was really hard to see that for some families, they were just in the process of getting a diagnosis for another sibling in the family right before COVID started. So I can only imagine what the wait lists and things must look like right now, and the supports that are not available for these families. So basically, to summarize this, this graph is that families of autistic children during COVID-19, their satisfaction in this specific disability-related supports domain, so looking at formal supports, they're scoring worse in the pandemic. So one parent was quoted as saying, "My son experienced a substantial escalation in problem behaviors, including physical aggression, during this time because we had considerably less access to supports and services. This negatively impacted our family." So this parent drawing or attributing this a lower quality of life to less access to services and supports. So this last domain in this family quality of life scale is the emotional well-being domain. So this domain measures perceptions of stress and support availability, so informal supports. So for this subscale, the parents are asked to rate how satisfied they are that they have friends or other people in their lives to provide support. So out of all 5 domains that we just talked about, parents rated this domain the lowest. So out of a possible score of 5, parents on average score a little bit less than half. So they have the lowest satisfaction in their emotional well-being. And during the pandemic, their emotional well-being dropped by 0.5 points if you look at before the pandemic, which was very significant. And this is not too surprising, given what we know about research that's just coming out now on the impact of quarantine specifically and social isolation on mental health and well-being. And this can be especially detrimental for families of autistic children, given how important and also reliant, as Grace mentioned, how reliant these families are on community and social supports. So one parent shared that at least 4 times we were in an emergency mental health crisis situation. So just to summarize, so families during the pandemic report a significantly lower overall family quality of life when we compare before the pandemic, but also in comparison to typically developing children and their families. And out of all of these 5 domains, caregivers report the lowest satisfaction in their emotional well-being.